just talked about all the body mechanics you should think about when transferring a patient or anything for that matter. So we're gonna go through a few different patient transfers that might be helpful to you in the home. The first one we're gonna do is just a simple sit to stand transfer. So Karen's gonna be my patient, I'm gonna be the clinician. So Karen, before we try to stand, I'm gonna have you scoot to the front of your chair. Good. Some patients are gonna have no problem doing that on their own, but for other patients who have become really weak and deconditioned, even that can be difficult. So usually I teach them this technique to move forward in their chair. So Karen, I'm gonna have you press your upper back into the top of the chair, and that's gonna force your hips forward. There you go, nice and easy. And then from there, lean your chest forward. Perfect. The next thing you wanna always remind a patient to do is to use their hands to push off, to pull their feet up underneath them. A lot of times they'll have their feet way out in front of them. They really need them, underneath their center of gravity, and then to lean forward as they push off to stand. So I'm gonna help Karen do that transfer. So Karen, I want you to count to 3. On 1, you're gonna rock forward. On 2, you're gonna rock forward. And on 3, push off and stand. Whenever you're ready. 1, 2, on 3, big lean forward, push off, and stand. Perfect. And you can see I've got a great grip on her gait belt with an underhand grip so that I can help protect her in case she has too much momentum and falls forward. Perfect. All right, you can have a seat. The next transfer we're going to talk about is how you would do more of a dependent pop-over transfer. So for a patient who can't stand on their own, needs a little bit more assistance, maybe to transfer out of the bed to a wheelchair or out of the bed to a bedside commode, this is the type of transfer you would use. So we're going to use a second chair just for demonstration's sake. And you want to always bring the second surface as close to your patient as you can get it. The first general principles are still the same. I'm going to have Karen try to scoot to the front of her chair. Perfect. So if I know that she can't stand on her own, she's not going to do a lot of this on her own and I'm really going to be helping, I'm going to have Karen grab onto my elbows. You never want to instruct a patient to grab behind your neck or around your head because they can get fearful right in the middle and it could end up being a bad situation for the both of you. So Karen, I'm going to have you grab my elbows. I'm using my knees to block the knee closest to me. Karen's not going to stand all the way up, she's just going to pop over, so this will give you some good control over where she's going. So I'm going to get nice and close to Karen. Again, you want to keep the load close to your body. And we're going to do the same thing, count to 3. 1, 2, and on 3, she's going to lean forward, push up, pop over, and sit. And there you go. We just did a nice little dependent pop over transfer. Karen didn't do, how much work did you do there, Karen? Okay. So you can do that really easily. It's a really quick movement. But as always, if you feel like you need help to do these transfers, don't be afraid to ask a caregiver or someone nearby to help you make the transfer safe for both you and the patient. The next transfer we're going to review is a dependent supine to sit transfer. So this is not me teaching the patient how to independently do a transfer. This is if I know that she's totally dependent and can't help me with the transfer a lot and I need to do something quickly or safely. This is the type of transfer I would use. So the first step would be to bring the patient into hook lying position, which is just with the knees bent. Some patients can do that on their own, but if they can't, the way I typically do it is take one arm, hook it underneath the knees, and you can see I'm lifting with my legs and not my back, and bring her knees to a bent position. All right. From here to perform the transfer, I'm going to hook one arm underneath her knees and the other arm underneath the shoulders. So again, lifting with my legs, I'm going to bend down nice and low. Hook here, hook here. And then we're going to use momentum to get her sitting up. So on 3, we're going to move to a sitting position. All right. On 3, 1, 2, 3. Very good. So there you can see that she's in a sitting position. Ideally, a patient who would be dependent would be in a hospital grade bed, so you can move them up and down to be at a more appropriate height. We don't have a hospital bed, so this will make do. But again, I lifted with my legs, use the momentum to pull Karen up to a sitting position. Once the patient gets to the sitting position, they might have poor trunk control, so it's important you stay close to the patient, keep your hand and eye on the patient until they get their bearings, and have good enough balance to sort of maintain that position. And then to move her back to a supine position, you just do the reverse. I'm going to hook one arm underneath her knees, one arm behind the shoulders, and then do the opposite. Good. And and now she's back in supine.